Welcome, ladies and gentlemen. Thank you for being online with us. This is Heart Talk coming to you from Kuala Lumpur, 10 p.m. every Monday. Tonight, we have with us Hong Kai.
Yes.
Who is a chiropractor.
Yeah.
And we're going to find out from him why posture matters and all things chiropractic. So let's begin. Why does posture matter?
Why does posture matter? There are so many aspects to it, right? First of all, you look more handsome, all right? You look better,
Okay.
all right? You look more confident. And other than that, we talk about functionalities, all right? Why we talk about posture? Posture is actually your body position in space, right, at that moment of time. All right. When we talk about posture, it's not something that's static, right? It's something that is always changing, right? Like you can see like this now, you can see like this, right? When we lift things, when we carry things, when we move around the space, it's different, right? So when we talk about posture, people think about good posture, bad posture.
That's right. Normally, I associate the word posture with presentation. Yeah. But chiro is about health, right?
Yeah.
So how does that connect?
All right. Okay. So I want to like explain a bit more about the good posture, bad posture. I will frame it as we have efficient posture and inefficient posture. Okay. First, this is very physical, mechanical. All right. So if you build a tower, all right, cylinder shape, straight, it can hold a lot of weight. Any buckle in it, it will collapse. So for us, let's say if I do a back squat, I put 100 kg on it. If I slump my back or I over arch my back, I can injure something.
There's a big difference in how it affects your body.
Yeah. So one is efficient in doing this posture.
The particular task.
Yeah, in doing this task, right? So if I were to spin, for example, right? If I spin with my body planted or this thing, I cannot spin a lot. Right, so it comes to performance.
So dancers will be interested in that.
Yeah, so all these things and the things about posture when we slouch or when we come in this position, especially nowadays, computer, phones, driving, everything is in front of us, right? So
now,
yeah, right. So when we do this for long enough, okay, you start to wonder, I don't know, I get my neck pain, I get my shoulder pain. Then you say stress. Right. Maybe it's stress. Okay.
All right.
It could be, right?
Could be just physical, right?
Yeah, it could be physical stress. All right, because you put in this position, the muscle is working very hard to try to hold up your shoulder, hold up your head. Your head is heavy. Right. So these are one of the small things about posture. All right. So of course there are some other stuff like we talk about longevity. All right. How long can you last? All right, how long do you want to move around? All right, then you're gonna have an efficient posture to really move around with less effort and minimal damage to your body.
So what's the result if we have an inefficient posture?
Pain, all right, muscle imbalance, right? Worse things, all right, it can actually affect headaches. It can affect some people with swallowing problems, stomach problems. Okay. If you slouch like this for a long time, this pathway will be blocked. So if you're breathing harder, when you swallow, it's hard to go in, you get gastric reflux, right? So when you actually fix posture, suddenly everything feels a lot better. Yeah. So there's one aspect of that.
So some of the things we do is not a disease, it's just a result.
Yes. Disease is a bunch of condition that name by people.
Oh, okay.
Right. So we give these things a name, right? This is called upper cross syndrome. This is called migraine headaches, right? For us, these are findings, and it's a result of a certain dysfunction that we find out where it comes from.
Okay. So in your experience, when you meet a lot of people with inefficient posture, let's say, I don't want to use the word bad, because that doesn't describe anything. Right? So inefficient posture, that's a good word. what kind of changes or improvements can they have if they correct the posture? Like, what difference can good posture make in your experience? And I mean, how critical is it?
Okay. Most of the people that come through our door, okay, they don't come because they have pain yesterday. You know, usually people will observe, right? They will observe, maybe it will go away, right?
Yeah.
So they come in after they have maybe 1 year of pain, 5 years of pain, 10 years of pain.
These are chronic
things, a lot of time chronic things. Then we can find out they do like go for certain things, they go for stretching, they go for massage, right? They do give relief. Okay, but ultimately they say, oh, it doesn't last, right? You come back, it doesn't last. Or probably they also go to another chiropractor, it doesn't last, right? Then we find out, okay, if you don't fix this posture like this, right, it will just keep on giving you the pain, right? The muscle can be good, like acupuncture is very good. Okay, massage is very good to this, but it doesn't help you to hold up yourself, right? So it's in the posture that is inefficient that the muscle is working extra hard.
So you're saying inefficient posture will just continue to cause an issue?
Yeah. So to really fix that they can feel, oh, okay, I know how to manage, all right, so that when I have pain, I know what happened, I know how it happened, I know how to prevent it, all right, so they have a more lasting effect, so they're generally more happy.
So it sounds as if your work with patients is also kind of, well, you have to teach them, right?
Oh yeah, a lot of
education stuff.
Education, a lot of.
You mean I just don't come here to crack the bone?
Yes. Yeah.
Okay.
Yeah. People that a lot of inquiries, right?
Yeah.
How much full body sessions? Okay. They expect it as like a massage parlor. So because this is what is in the main market, right? People go to massage session, you good, right? For us, it's more like problem solving. The first section, we take our time to assess all your history, right? Then we even take an X-ray, right, to see like the evidence of how you've been using your body in the past 10, 20 years, right? Then we provide you a plan and solution how to go from point A to not only pain-free, but to help, right? To help.
Oh, okay. All right.
So it's like a whole process.
Okay. Yeah. So aren't you kind of like sabotaging your business by getting people healthy? They won't come back.
They refer people. We work, when people get well, they refer people. So it's never a losing game. It's always
interesting.
Yeah.
Okay.
Yeah.
Because there is never a shortage of people who need some support, right?
Yeah. Here there's more than enough people and not enough to provide. The chiropractic you see there's a lot more that opening up one another, right? But it's still not enough to provide the population.
So, okay, so if someone is asking you, my son or daughter wants to be a chiropractor, is the profession too crowded? Your answer will be no, not at all.
Because there is pioneers in front of us, they are called dentists. So dentists,
I don't understand.
You can see one street of a block, train all dentists, right?
And they're all busy.
And they are still surviving. We are far from that. We are still new in Malaysia. 12 years from now, 12, 13, 14 years now, it's still new, right? The thing is, the school that is producing chiropractor now is IMU. That is the only one in the whole.
How long have they started training chiropractor?
2010.
That's very recent.
2010. The chiropractor that is present before that, they come in from
overseas.
Yeah, they might study in US, UK, Australia. Now, IMU is the main, institute that provide all chiropractors.
So where does chiropractor come in? If you look at the entire health profession, where do you come in? What's your part? The health in the health industry.
Okay, I always see us that the chiropractor as there to complement and fill up the gray area, the mid gray areas in the healthcare industry, the healthcare system now. There are two ends, like when we talk about healthcare, there are people that in the Western medicine, especially in the mainstream medicine, right? So people, when you go to a general practitioner, their tools to treat back pain is not a lot, right? what do they do best is giving out pills.
Well, that's one way.
Yeah. So that is one thing that they do best, right? They might know that you need to do physio and do that, but themselves are not the provider of that. All right. And if you are not severe, they say take these pills, 5 to 7 days should be fine. And a lot of people actually fine about it. So that is actually a good way to screen out a lot of transient problem like
temporary,
right? Or if they see serious enough that I don't think this cause of it, if you not go through a course of medication is not working, maybe you need to find other stuff. Okay, so in the healthcare system, the next thing to it is orthopedic surgeon.
Oh, okay.
Yeah, so bone specialist, right? Say, this is not something that I have and it's not resolving, right? Probably you're gonna see a orthopedic surgeon. So then orthopedic surgeon have more tools to it. Right. So what tools they have? They have injection, minor surgery, major surgery, right? And this is what they do best. They are surgeon. Right. If your case is not so, we call not so bad enough until you need surgery, it's little that they can do. They say, yeah, good, nothing much, go to physio.
That's when they go to physiotherapy.
This is where chiropractor comes.
So I think the screening is that the GP and the orthopedic just make sure that there's nothing serious.
You can say so.
In the sense that it needs intervention.
Yeah.
Then it's a physio if it's just a matter of.
Correct. So chiropractor actually come in from this end to this end, right? Of course, if it's serious enough that we call conservative treatment, this kind of treatment without medicine, surgery, cannot be helped, we refer to surgeons.
Oh, so you refer to surgeons when you see, okay.
Like, they are not going to respond to this treatment, tell them friendly, right? So, and a lot of people, they're in between here in the gray area that nobody cares, right? GP gonna help, or the decision say you're not severe enough until this stage, right? These are the chiropractic.
Oh, that's your space.
Yeah, and there is a huge space. Yeah, and even the people that, one thing that, yes, even they know that the surgery would be better for them, there are people that opt for non-surgery. They say,
they want to exhaust the options first. Before surgery.
And even surgeons themselves, they know you try conservative treatment first. They will say you give 4 to 6 weeks. If it doesn't respond, there's ultimate. So this is where we stand, and that's basically most of the cases. That we see.
What would you say is the chiropractic contribution to general health? Where do you see it as a unique contribution?
Okay. One thing that we have in the toolbox, is actually to assess the joint, the movements, all right, the function of it. Okay, so orthopedic surgeon a lot of time look at the structure. Okay, so you look at the structure, the knee is like really raging, you're gonna cut it off. Right? A lot of times the knee is not really there, but the function is a problem. These are the things that doesn't show on X-ray. These are things that need to be assessed and need to treat functionally. For example, like maybe I'm gonna fix the alignment, right? So how it's moving, like it's straight, right? Is it one side or the other? The muscle imbalance, right? The way that you walk, the way that you squat, the way that you carry things. So all these things are the best of chiropractics, right? And one thing that we offer best is the specific adjustments. So when we say adjustment, we help the joint to move properly again, so that it doesn't give stress on certain area of your body. That's how we help chiropractic adjustments.
But when you talk about the knee, then you suddenly talk about the other areas, like what do you say? You said the knee, and then
the
pelvis, and all that. So how do you know what to adjust, and do you adjust more than one thing at a time, or what?
That comes the whole assessment system. We call clinical reasoning. Unless you have accidents to your knee, so like you fell down, you twisted your knee, all right, crush your knee, right? Okay, the problem coming from your knee. But most of the time, 90% of the time, I develop knee pain out of nowhere.
Seemingly.
So I just walk more. Maybe lately I walk a bit more. I got knee pain.
On one knee only, not the other, not both.
Why does it coming from your knee?
Okay.
Right? Why does it happen on your right knee? Overuse? No, you have two legs. You don't jump with one leg. All right. So it's something to do with your alignment. Right. So if you're shifting one side takes more pressure. Right? Or if your one side of your muscle is tight, all these things. Yeah, these are what we see as alignment problems. Yeah. And posture. This posture is the one that can affect this as well.
So it's just inefficient or off track or okay lah. That means it's needs adjustment. Okay.
Yeah.
So you adjust the physical to address the functional.
Correct. Yeah. So a lot of times when we adjust the joint, right? What is the purpose of adjustment? Okay. So the joint is moving in, for example, there are two joints here. They are moving in a certain way. So the rotation center, let's say, is here. It should move nicely, right? So, for example, if you are slouching a lot, you are stuck here. Okay, now it's stuck in flexion, right? It's stuck in front. So it changes its rotation center. So it doesn't go back anymore, right? So in this kind of movement here, right, it creates muscle tension aside. It creates joint pressure. It creates we call maybe shoulder problem, things like that, right? So what we do when we adjust it, we actually try to restore this joint movement, right? When it's moving normally again, suddenly there's no more stress there. Your blood flow is better. Your nervous system is flowing better, right? Sending signals from your brain to your body, right? So nothing is during that process. Then your body recover. A lot of people they ask us, sure can or not? No need medicine, man. Right? Right. So a lot of people they are because they are educated this way that sick you need to take medicine, right? But your body can heal itself when given the right opportunity, the correct rest, the correct movement, the correct nutrition. Can rest. It can heal itself.
So you actually do not prescribe medication at all.
We do not. Yeah. Unless the medication that is useful for people that is in acute stage, or usually like what is the cutoff line that I advise my patient to get medication? If you cannot sleep, painful and you cannot sleep, get medication. Because
but you don't prescribe. You get a doctor to.
You go to the doctor. Correct. You may go to pharmacy.
Just to help that aspect.
Yeah. If you cannot sleep, your body cannot recover.
Yeah. Okay. You know the limits of what you can do, right?
Yeah, you gotta get through that stage.
Yeah.
All right. So there are places of medicine. Yeah. And a lot of times, with the medicine, people can rest. People don't feel like nothing, no pain. They can walk up again. But suddenly they recover because of the good movement.
Oh, okay. I'm just thinking, what are the advantages of having a well-adjusted body, which that means efficient posture in every aspect of your physical life?
Yeah.
What are the advantages or what's the disadvantage of not having that? I mean, is it serious? I mean, how serious can it get?
Yeah. I can speak from my personal experience as myself receiving adjustment.
Okay.
Right. So I received my first adjustment actually in when I was studying in uni. Right. So I was studying this course. Right. Then my lecturer adjusted me for the first time. I had like injury in my hip. I got the hip is not flexible. I do taekwondo. Hip flexibility is a main thing for me.
Okay.
Right? If I'm not flexible, I cannot perform. Right? I thought I just need a lot more warm up. I need a lot more stretching. Right?
Okay.
Right? The magical things after the adjustment, the next day my leg was like, I don't need warm up. My leg can go up.
So there was something there.
Yes.
What sort of injury?
I have a hamstring tear.
Oh.
That is a small things, right? It's just the hamstring tear, but it affects my walking. That become a chronic thing. A lot of times like this, it's a small thing. It starts from small thing, maybe you just sprain your ankle, but it affects your walking, it affects your movement. It becomes a long-term thing. Yeah. So it's been years, right? Right. Then one adjustment is like, wow, he didn't even address my hip, nothing. He just adjusted my pelvic. Wow. Yeah.
So some of us say we're getting old. It's not necessarily true.
Yeah. A lot of time they blame on getting old.
Yeah, getting old.
Yeah.
So like, what do you expect? How old are you now? Come on, you know. So that's not necessarily true.
Correct. It's like a car. If you maintain it well, you can drive a long time. All right. Without maintenance, you get like sounds, you get problems.
Yeah. And then one problem will cause another problem.
Yeah. Our body is great at compensating. Your body will find a way to make things worse.
But in making things work, then compromise.
Correct. Yeah. So other than like this is my personal experience in performance, right? They are in about your sleep, right? A lot of patients they don't come in because of sleep problem. They come in, they say, oh, I got neck pain, back pain, and they tell us like after the adjustment, I can sleep better. Or they tell us like one funny one is there's a lady, right? She got a neck problem here, so I adjusted it. Then she say, wow, it feels like she's like something brighter now. She
see color now.
Yeah, she's like that, right? She's like, oh.
That means what do you brain fog?
Yeah, right, something like that. So it's like she's like blur all the time, like she's slow, right? She's young, 30 plus, right? Like after that she's like come alive, and you can see the eyes come alive, like oh, the world is different. Right, so these are things that can put pressure on your body, nervous system without you knowing. You might think that this is just you stress, right?
We will just say, well, we actually do not think we can change it.
Yeah. Gonna try get an assessment. Yeah.
Okay. So thank you for sharing these insights. It's like we could talk another hour.
Yeah.
So ladies and gentlemen, I think personally I think you should see a chiropractor to get an assessment. Yeah. Because I have a regular chiropractor. I do know the benefits of time. And because he adjusted me and I became more conscious of how I hold my body and all that, I feel kind of lighter as such, and that's one experience. And as I went back to him, it's very interesting. I used to go to him every 2 weeks, right? Because it's the beginning. And the first thing he found, and if I look at myself in the mirror, I was actually off balance. My shoulder was forward, and the body was actually slightly so weird. So he adjusts, and then somehow everything leveled out. And then now I only see him once in 4 months. 4 months just to check.
Yeah.
And it also encourages me to do Qigong because I noticed my Qigong exercises actually gets me back into the posture. So, ladies and gentlemen, I think I vote for chiropractic because they occupy a space that nobody else does. And I have one final question because I'm curious, and then we'll end here. You know that cracking sound?
Oh yeah.
Where does it come from?
Okay.
I found out where it was. It's a very strange way of causing the sound.
Yeah. It is according to research, right? The most current research it says is the sound of the air bubble releasing the joint.
Yeah.
Right. So when you create a negative pressure, the air actually like come out from the fluid, then it makes the sound like pop or crack. Right. Yeah.
So he's not cracking your bones, okay? He's just causing that the air bubble.
We call it cavitation.
Cavitation.
Yeah.
The thing that submarines don't like it to be noisy.
Yeah.
So that cavitation, is that a side effect of the adjustment, or is that the adjustment?
That makes you feel better.
Yeah, it does.
Without the sound, it does the job. psychologically,
Oh, yeah,
you
yeah.
have, whoa, a lot better, right? After the sound, like, whoa, something is done.
Yeah. And sometimes on the left side, wow.
Yeah.
Then on the right side, not so much sound. Did it? And then the guy said, no, it's okay. It happened.
Yeah. Yeah.
Right. So thank you, Hong Kai, for being with us. And I think we brought a little bit more of informed understanding of chiropractic. Appreciate the time.
Thank you. I'm honored to be here as well. Thank you for your invitation. It's great talking with you all. Right.
So, ladies and gentlemen, good night. See you next week at Heart Talk, 10 p.m. every Monday from Kuala Lumpur, Malaysia. Good night. Bye.
Good job for the talking.